Dr. Sean Chaudhry here with Neural Effects, and today we're talking about diabetes, a chronic condition that affects your blood sugar. Generally characterized as your A1C number or your 3-month number being above 6.4. And we know that pre-diabetes, your numbers being anywhere above probably about 5.7 to 6.4 depending on the lab that you go to. That's a standardized number, or anything above 127 on daily blood sugar is generally what's characterized as diabetes. Now, it affects about 10% of the population, and we know that it's getting worse. We know that we're seeing it more in kids than we've ever seen before. And the general things that they tell you to do is what you should, watch what you eat, you should exercise, and of course, take your medication. Those things aren't working as well anymore as they used to, and sometimes now we have to look a little bit deeper into the condition and maybe give you some more tricks that may help you improve your condition if you have it, or maybe prevent the condition if you don't have it. Now, generally, there's a problem with your body metabolizing sugar. You can be hypoglycemic, which means your blood sugar is too low. You may feel irritable and shaky if you don't eat, and then after you eat, you feel better. You may also feel, sleepy or tired after you eat, which may be more insulin resistance type symptoms. And we know that there's two types of diabetes, right? Type 1 diabetes, where you're insulin dependent, which means a lot of times you have to take injections or you have to be on a pump. And it can start when you're very, very young, between 15 and 20 some years old. And we know that, of course, type 2 diabetes comes on later, or what's known as adult onset diabetes, which is what the majority of the population has. Now, what we find is that generally, if you have diabetes, you start with one medication. Generally, they'll tell you to take it in the morning, and then after several months, 6 months, 8 months, 9 months, then you may find yourself taking two medications. You might be taking that medication in the morning and then also in the evening. And then next thing you're going to know, within the next year, you may be taking a second medication. You may be taking a shot. You may be doing a bunch of different things. And once that happens, then you may end up on insulin, which basically means that your body is not improving. It's actually getting worse. Now, why would that be? Why do we have more diabetes now than we've ever had? Well, for some people, there's more stress, all right? And so what we know is that there's more stress on their body. And the 4 types of stresses are 1, emotion, 2, chemical, 3, physical, and 4, traumatic. So stress wreaks havoc on your body, and it can make your blood sugar go up on its own without just eating wrong, right? So, we know that we should avoid sugars and things that can turn into sugars, and, eat less carbs and less bread and less white. That's all said and good, but you can find that information anywhere, and some of you have already tried that. So what we look at are what are the things that may be a little bit different that you might be able to try that might be able to help you. So for some people, exercise actually might not be in your best benefit, because we know that your adrenal glands may be fatigued. Your adrenal glands sit on top of your kidneys, and they produce cortisol, which is your stress hormone. Many people know of it, and women especially know of it because it's touted on commercials because it causes belly fat, right? So what we become concerned about is different stressors may affect your blood sugars. Now also, different kinds of infections can also affect your blood sugar. For instance, for some diabetics, if you've ever been sick or if you've had the flu, what happens to your blood sugar? It goes up, doesn't it? So sometimes you have to take a different approach to looking at diabetes and looking at what other things are within your body. Are there any viruses that you have? Any bacterial infections that you may have? Are you allergic to certain things? Meaning, it may not just be what you're eating, per se, as in sugar content or in carbs, but it may be something deeper than that, where you may have an allergic reaction when you eat something. Now, what's interesting is we had a diabetic that came in to see us. His blood sugar was running in about the 300, 350 range. And interestingly enough, we put him on an anti-inflammatory diet. And in that anti-inflammatory diet, 1 week of it was a no meat week, where he wasn't allowed to eat any meat. And what we found is that when he removed beef, his blood sugar went from 350 all the way down to 80. He was on 2 forms of insulin. The insulin wasn't able to stabilize it. Even the low carb, which was the 2 weeks before he got to the no meat week, The 2 weeks of low carbs didn't drop his blood sugar either. So what it wasn't all the meats, but it was one meat, and by going through an elimination diet, we were able to figure out that he had a food sensitivity towards beef, and that it was causing his blood sugar to be elevated. Now, everybody's food sensitivity or food allergy may be different, or you may not have one at all. But that's something that you should definitely look into when you have uncontrolled or unregulated blood sugar. For many people, of course, if you watch your diet, it's going to lower your blood sugar. Another trick that helps for diabetics is something called chromium picolinate. Chromium, for a lot of patients, if you take 200 milligrams with your meals, it'll help stabilize your blood sugar. Also, things like cinnamon have also been known to help blood sugar. Now, also, if you find your doctor, have them look for infections, right? Infections in your body. And then, of course, looking for the different chemical stressors, the different emotional stressors that you may have, and then any traumatic stressors, meaning anything that would cause pain. Because pain may also allow your blood sugar to come up, and so you may need to address the pain. Because one of the main treatments for pain sometimes is a steroid, whether it's a steroid injection or a Madrigal dose pack. Those kind of medications may make your blood sugar go up. And if it makes your blood sugar go up, it may stay up for a while and of course bring your A1C numbers up and your overall blood sugar up. So what you want to do is you want to look for other things that may be causing your blood sugar to not be stable. And as always, don't make any changes without talking to your doctor first. But sometimes when you're not getting the results you desire, sometimes you have to make a change. Find a different doctor that may be able to give you different answers. We'll see you next time on your next Medical Minute.